what we're aiming for is to offer alternatives to hospitalisation for older people when they become acutely unwell. We provide rapid geriatric outreach assessments for older people who might be undergoing a cognitive, physical or functional decline and are at risk of hospitalisation.
We're in a very privileged position in our team because we can actually see patients who live in the community in their own homes and also in residential aged care facilities in their homes there. So we can see people who are rapidly declining, becoming unwell, maybe with infections such as urinary tract infections, pneumonias, cellulitis, maybe requiring intravenous antibiotics, maybe just oral antibiotics. People who become unwell with flus and viruses and gastroenteritis, they might need some hydration, and we can easily set that up in the home situation.
So hospital avoidance programs for older people in the Northern Sydney Local Health District. There's 3 services. There's GRACE, which is a geriatric rapid acute care evaluation that covers the Hornsby-Ku-ring-gai area. There's BRACE, which is the Beaches Rapid Access Care of the Elderly, and that covers the northern beaches of Sydney. And there's also ARRT, the Aged Care Rapid Response Team, and that covers the lower North Shore, Ryde and Hunters Hill areas.
The major benefits of having the Aged Care Rapid Response Team is to help GP to look after the elderly population in a non-hospital setting.
With all patients, once we get the referral, we come out and see the person at home and we do a comprehensive assessment. During that assessment, we may take bloods. We can refer on to mobile X-ray or to mobile ultrasound if we think that's necessary. We consult with the doctors on our team who either visit at that first visit with us in conjunction, or they will be available to do a Skype or teleconference interview. So they can actually see and visualise the patient, see what we can see, but they don't actually be present within the facility. And that's fantastic because it allows us much more scope and flexibility so we can see more patients in a day.
Another benefit is that ARRT can collaborate with GPs and facility staff and carers, and that allows us to get a really comprehensive idea of what's going on with the resident or the older person. So we have access to hospital records, but we can also look at aged care facility records and speak to GPs and speak to family and find out what's really going on with that person. That allows us to be really patient or person-centred in our goals of care. So the treatment that we provide actually is really about that person and what they need at that time.
So recently I had a resident in the aged care facility who had a chest infection. Unfortunately, he did not respond well enough to oral antibiotics. Also, he got a bit more confused due to his chest infection. So the option of sending him to the hospital for intravenous antibiotics would cause him more distress because of his confusion. So I made a referral to the Aged Care Rapid Response Team for intravenous antibiotics at the aged care facility. He recovered well from the intravenous antibiotics, and also that saved a trip to the hospital. So that was a good outcome.
We can refer on to other community services, and then we do that quite frequently. So we would refer on to behaviour management services, Dementia Services Australia, palliative care, APAC Hospital in the Home, and other services to support someone to stay at home. We also can organise urgent ambulatory care referrals for someone who needs those. If an older person does need to come into hospital, what we can do is organise a direct admission for them into the assessment unit, medical assessment unit, or we can fast track them through the ED, and also we can provide potentially alternative place destinations, so they might go into a private hospital or they might go into rehabilitation.
We're looking at building capacity within the staff who are working in the residential aged care facilities so that they can better manage their residents without necessarily our support all the time. So we provide the education that they really need. We provide education depending on the needs of the facility and the needs of the staff within that facility and the needs of the residents that are in the facility. So if a resident returns home, we might provide special education for that particular resident and those staff so they can better manage the resident so he doesn't need to go into hospital and he can be well cared for at home. The Detecting Deterioration project is particularly interesting and particularly valuable. We have inherited a flip chart which we worked in collaboration with the Primary Health Network and the other teams, the GRACE team and the BRACE team, to revise the flip chart to make it a little bit more user-friendly for people in the residential aged care facilities to utilise. But with ARRT, we've really focused on bringing the DETECT training that's used within New South Wales Health into the residential aged care facilities. So we've used the A to G algorithm, which is a systematic way of assessing a person, and we've introduced it in a way that can be used in residential aged care. We have introduced the training in two parts. There's a classroom face-to-face training which we've been providing to the facility staff in classroom type settings, and that's been particularly well received by the staff that have come along, and they all felt much more confident and competent in their skills of assessment following the training. The second part of the training is an online module which gives 2 hours of education points to the registered nurses who attend it, and a certificate of attendance to the care staff and the registered nurses who attend it. And it really helps them to hone their skills in patient assessment. We're really grateful to the Sydney North Primary Health Network for helping to support this project. They have funded the flip charts and also the online module. And we're just encouraging nurses to do the training and attend the training, which doesn't have to be done in one go, but can be broken up into small modules or a few minutes whenever they have time. When they are handing over the clinical handover to doctors or to the ambulance or to the rapid response team, we're helping them to learn how to communicate using the ISBAR format. So using something which is a standardised communication tool which can get their message across. They introduce themselves, they say what's happening here and now, what's the situation, what is the background to this patient, what was their assessment, using that A to G, what was abnormal in that assessment, and then what is their recommendation. Do they want us to come and visit? Do they want the patient to go to hospital? Do they want the GP to come next week, or would they like somebody to come and see that patient now? So by using this format, it really gives them a structure on how to hand over that information to whichever clinician they're handing over to.
The clinical nurse consultant and the specialist in the aged care rapid response team will help us, the general practitioners, to provide a better health outcome and person-centered care for our patients. It is very easy to make the referral. Either it could be done by the GP or by the nurse or by the person themselves. They have a direct mobile number that you could call during working hours, Monday to Friday.
So there's lots of benefits for the ARRT service for residents and their families. So the first thing is that it reduces those risks of hospitalisation for older people. Studies have shown that there's much better health outcomes for patients or older people who are treated in place rather than being in hospital. So one study showed a 19% reduction in mortality, which is quite significant for people who are treated in their home rather than going into hospital with the same disease, the same complexity and the same acuity. The most significant benefit for residents or for older people is that we give them the right treatment at the right time for the right person in the right place.